Hi, this is Jessica DeMassa at the Guidewell Insights Lounge. I'm here with Neil Jacobstein, who's the chair of AI and Robotics for Singularity University. And also, I'm sorry, what did you do for Stanford?
A visiting scholar at Stanford.
Excellent, wonderful. Well, thank you for joining us here today. So, Neil, we know that obviously you're an expert in artificial intelligence and robotics. So can you tell us a little bit, what has you most excited about artificial intelligence being integrated into the health industry?
Well, the thing I'm most excited about is the recent high performance of machine learning algorithms. We've gone from a very long history of AI in medicine where we were able to get results, and they were good results, but they required constant care and feeding in building these systems. And the systems were not as good as they are now. We're now getting amazingly high levels of pattern recognition accuracy, and we're able to see things with massive amounts of data that we couldn't see before. So I think what excites me the most is the opportunity to integrate data from our genome, data from our wearables, data from our medical history, data from other people that have similar problems, and we'll be able to pull all of that together and make amazingly good inferences and forecasts about what problems we're likely to encounter in the future and what we can do about it now to be proactive.
So speaking of that, so what problems should we be trying to solve leveraging AI in healthcare? What are some of the things that we can tackle?
Well, I think the most important thing to tackle is to get everybody in a health maintenance and management regime. An amazing number of people, not just poor people, but also people of means, do not really actively manage their health. And now we're going to be able to provide a 7x24 coach for people.
Right.
We'll be able to give them real-time feedback on their health metrics that we can take with wearables and other devices. And we're going to be able to enable people to, for the first time, really manage their own health.
Is there anything that we should be afraid of with AI and machine learning, privacy-wise or security-wise? Is there anything that we should be concerned about?
Well, I think that there are HIPAA rules in healthcare that protects patient privacy, but I think that what we should be more concerned about is not using our data to manage our healthcare. There's the potential for abuse in violating people's privacy, but I think we're growing up into a society where we can accept people's differences and hopefully spend more time working with our data and using our data than worrying about privacy. And then in terms of things to be concerned about, as AI gets more and more advanced, there are large numbers of researchers that are increasingly paying attention to what we need to do to make AI beneficial and safe.
Yes.
And I've attended conferences and committee meetings on this. And I think that people who are in the field are aware of what some of the potential risks are, and they're actively working to prevent them.
Excellent. So what has you most optimistic about the future of healthcare from your perspective as somebody who's reading about AI and robotics?
Yeah, well, I think that for the first time in human history, we're going to be able to intervene in our healthcare in a way that was just unthinkable before. We're going to be able to use techniques from synthetic biology to repair problems with our genome. If you're born with a disease that prevents you from making an enzyme, we could potentially in the future intervene and eliminate that problem. I think that we're going to be able to utilize both AI and synthetic biology to treat our health as an information problem. And once we can treat our health as an information problem, we can forecast what might go wrong, we can intervene and edit what is going wrong, and we might be able to both extend the period of high quality of life for people within our current lifespan, and then we might even be able to extend our lifespan. I think both are realistic in the future.
Excellent. Well, thank you so much for joining us
You're
here this
welcome.
afternoon. It was wonderful to speak with you. Thank you.
Thank you.
We will be back with more from Guidewell Insights Lounge.